Risk and behavioral scientist, Dr. Shudder Chakraborty. Doctor, this New York City doctor goes on to say that social distancing is playing too much of a predominant role and herd immunity is important to fight a pandemic like this one we're in. What's your response to that? Do you agree with this op-ed?
I do agree, and we're hearing this increasingly from medical professionals on the front lines. These severe social distancing measures were never going to be sustainable. In countries that have stricter governments and societies, human behavior is still not fully compliant to this type of distancing that was put in place, much less in Western democracies like the United States. And so ultimately, this wouldn't have been sustainable. And we're not going to get a vaccine still for some time. So ultimately, what needs to happen to reopen the economy is a couple things that this doctor also mentioned, which includes some trust that the public health capacity is there. So if there is a rise again in COVID-19 cases, that there is capacity to be able to address those cases and help those patients. And also just ensuring that we have the testing and the contact tracing in place. These measures, once are more or less comfortable, we can begin to think about reopening, because the peak, once it passes, there really isn't a need at that point to continue, again, this severe social distancing, which is doing more harm than good. I've also said from the very beginning, think about all of those patients that are not coming into the ER, that are probably dying at home from the disease that kills more than 600,000 Americans a year, which is cardiovascular disease, heart attacks, strokes. All of these things are potentially on the rise. Children aren't getting vaccinated on the schedules that they are intended to be on. So there's a lot of ripple effects here that are being really not put into the equation when we think about the overall public health impacts associated with COVID-19.
Yeah, you mentioned when we spoke maybe a month ago about the harm that could come from taking these extreme measures. Now we're kind of seeing it play out. We're seeing these protests pop up of people essentially saying we can't take it anymore. We have to get back to work to continue on with our livelihood. And you study specifically people's behavior. You know, in New York, we haven't seen an uprising, but will there be a tipping point? Could there be a breaking point for New Yorkers specifically?
Right. Well, think about it like this. In California, which has been a state that has been under lockdown even longer than New York, what we're seeing is more and more people that are ignoring adhering to the severe social distancing advice. We saw people on the beach this past weekend as the weather is improving. I don't doubt that the same will happen from New York. There isn't that much of a cultural difference between Americans from California and New York City. And this, again, adherence was never going to be, and is definitely not going to continue to be perfect as more and more time passes. And so what we need to think about now is transitioning from severe social distancing to moderated social distancing, which honestly should have been the case from the beginning. It should have been disposable menus, like we're hearing from the CDC now as restaurants think about opening up. It should be keeping that 6 feet distance apart from one another, thinking about having children eat lunches at their desk as opposed to in crowded cafeterias. All of these are cost effective and sensible, just like enhanced social hygiene. And those should be some of those practices that are really put in place, not just because of COVID-19, but just generally over months and months as we think about how we're going to reopen the economy and in preparation for an inevitable emerging infectious disease again in the future. This wasn't a one and done. It's going to come again. So there's best practices to take away from this to implement in society, but it was never these severe lockdowns.
Yeah, well, those are some great solutions that you offer, and I'm hoping for everyone's sake we continue to wash our hands as much as we have recently. That's risk and behavioral scientist Dr. Shudder Chakraborty. Thanks so much.
All right, coming up, Florida plans to join